Having a stroke is an emergency medical situation, and according to an ER doctor with Doctors Regional in Corpus Christi, someone has a stroke every 40 seconds, and every 4 minutes someone dies from a stroke. Texas recently adopted updated guidelines when it comes to treatment. I learned better care and increased stroke awareness can be the difference between life and death for those in the coastal bend.
You should act very fast because there is a very narrow window in case there is a blood clot in your brain, like a heart attack in the brain, that we can give a medication that we can reverse the symptoms.
Associate Medical Director for Corpus Christi Medical Center Doctors Regional, Dr. Juan Ramirez, says for every 100,000 people in Nueces County, 80 of them will experience a stroke. First responders play a huge role in determining how a patient is treated upon arrival to an ER.
Usually we are notified by EMS that the patient is coming with a stroke, and there are two types of strokes.
They are ischemic stroke and hemorrhagic stroke. Ischemic strokes are caused by blockage of an artery or, in a rare instance, a vein. It's the most common type and accounts for about 87% of stroke victims. Hemorrhagic strokes account for about 13% of stroke cases and occurs when a blood vessel that supplies the brain ruptures or bleeds. Doctors say it's key to seek care within hours to avoid long-term damage. When it comes to treating stroke patients at area hospitals, minutes matter. Doctors spring into action, and depending on when you make your way to a hospital can be the difference between permanent damage or the reversal of symptoms. Doctors say some contributing factors to a stroke include age and lifestyle choices.
Also, people who is overweight or is sedentary, or people who use binge of alcohol or drugs, they are more prone to develop strokes, not counting if you have baseline diabetes.
But there are ways to reduce your risk.
Just follow your doctor's advice and take your medications and follow up with your blood work. Make sure everything is aligned. That's the number one.
Dr. Ramirez says, in addition, if you're the type of person who likes to sit, he recommends you start exercising. And for those who are obese, it's time to start a weight loss program.
There is a lot of lifestyle changes that if you take care of those, the likelihood for you to have a stroke are going to decrease significantly, and help yourself.
And according to Johns Hopkins Medicine, about 3% of people who have had a stroke, they have a second one within 30 days. 1/3 will have their second stroke within 2 years.